Well, a very good evening to you. Thank you so much for joining us here at Ebru Primetime News. My name is Rachael. Mbugua. Our sign language interpreter for tonight is Joyce Wairimu. Now, a 6-year-old boy has succumbed to coronavirus in Kenya, raising the death toll to 4. The boy was admitted at the Kenyatta National Hospital where he succumbed to the virus, with the Ministry of Health saying that he had a pre-existing condition. Our reporter Jeff Hyember begins our coverage tonight.
A sad day in the country, as the country has lost yet another patient to the coronavirus pandemic. Just a day after 2 Kenyans succumbed to the disease, Health Chief Administrative Secretary Mercy Mwangangi on Friday during the daily COVID-19 updates delivered another heartbreaking story of a 6-year-old child who had succumbed.
I am saddened to inform you that we have lost another patient to the coronavirus disease. The person, a 6-year-old male child, who was also ailing from other medical conditions and had been admitted to Kenyatta National Hospital. This now brings to 4 the number of those who have died as a result of this disease.
The boy was overwhelmed by the deadly virus. He is said to have arrived in the country with his parents from India and not knowing that he had contracted the virus.
When we are here.
It is said following the other health conditions he had been admitted at the Kenyatta National Hospital before being confirmed positive of coronavirus.
This 6-year-old child, we're informed, already had a pre-existing condition. One of the condition that the child had is a condition that actually causes immunosuppression, and it's a condition that affects the bone marrow. Therefore, this child, as we've explained over and over, is that when COVID comes in, coronavirus attacks those who may have immunocompromised states. And
this brings the total number of the deaths from the coronavirus in Kenya to 4. The health officials at the Kenyatta National Hospital who handled the patient are now worried, not knowing whether they have contracted the virus or not. However, Health Director Patu Kamoth says proper measures are in place to save the health workers.
The necessary infection prevention control measures have been put in place, including quarantining of the staff that handled this particular deceased child. We have also been in contact with Kenyatta to ensure that that particular place has been disinfected and all those patients moved elsewhere. We are in the process, of course, of testing them because, you know, people who are in ICU, in terms of risk profile, they are at a very high risk of contracting COVID.
COVID-19 remains a major threat in the country following its sporadic spread. From 110 confirmed cases in the country, the number has now ballooned to 122 after new cases were reported.
in the last 24 hours, we have managed to test a total of 362 samples, out of which 12 people have tested positive for coronavirus disease. Out of this number, 11 are Kenyans and 1 Somali national. This now brings the total number of those who have tested positive for the disease in the country to 122.
Mercy Mwangangi says the 12 patients have been moved into isolation in different facilities designated by the government.
The 12 people have already been moved into isolation in our various health facilities. Currently, there are 648 contacts that we are actively tracing. I would like to appeal to those who are hoarding oxygen cylinders to release them.
Across the world, about 55,000 people have died of COVID-19, with more than 200,000 people recovering from the virus. More than 1 million people have been infected. Reporting for Ebru TV, I'm Jeff Hyember.
Now, mass production of masks in the country has officially begun. Speaking during the daily briefs on the state of COVID-19 in the country, Cabinet Secretary for Trade and Industry Betty Maina says Kenyans will now be able to access the masks at not more than 20 shillings.
The mass production of the masks locally is set to curb the shortage of the much-needed gear that saw one woman inventing a makeshift mask from a plastic bottle. However, that is no longer necessary as the local textile industries have taken up the challenge and started the manufacturing of masks.
We have capacity from local industries, at least what I have assurance for the material we currently have in stock among our fabric manufacturers is sufficient to make 60 million masks immediately. And we have instructed them to get in touch with their distribution chains and make this available to even tailors and other people in the villages so that we can expand our capacity as quickly as possible.
Trade and Industry CS Betty Minor also said manufacturing of personal protective gears have also started.
Pride as Kenyans is that we are replacing global supply chains in making these things for ourselves. It will be very helpful for the local textile industry that it can keep them employed, but I think it also helps us in enhancing our own sense of dignity as a nation, that we can produce these things for ourselves. From the indication that we have received from the manufacturers and the retailers, and given the volume expected, we don't expect any of these masks that is available for sale to sell for more than 20 shillings.
Production of this much-needed gears locally will ensure availability, hence reducing the cost. The government will, however, face a hard task of convincing Kenyans on the quality of the PPEs, to which the Health CAS Mercy Mwangangi said,
"We've employed and dispatched a mechanism and a system that's actually ensuring that everything that we are using in the COVID response has undergone quite intensive scrutiny and instruction through the regulatory bodies that we have in place. So Kenyans should rest assured what we have here present, as presented by Betty Minor, has also gone the different qualification processes with KEBS and with our medical practitioners on board to ensure that it is sound.
A section of health workers have decried lack of personal protective gears in the country, saying this puts them at risk of contracting the highly infectious COVID-19. Demonstrating the samples of the mask, Trade CS said very soon ventilators will also be produced in the country.
Perhaps the next time when we meet, we'll also be able to demonstrate the approved ventilators and other equipments. Our scientists are making advances in also developing the other products that we require for medical use, and I'm certain within the next week or so, there will be some announcements in this regard.
The shortage of masks and personal protective equipment has not only been experienced in Kenya, but other countries affected by COVID-19. Some frontline health workers in the US have been forced to use office supplies or reusing existing supplies more times than the CDC recommends in order to stretch supply. Winnie Lubembe for Ebru TV.
Now, Kilifi Deputy Governor Gideon Saburi has been arrested by detectives at the Coast General Hospital for refusing to self-isolate. The leader, who has recovered from the deadly COVID-19, will be arraigned in court to face charges of defying a government order to self-isolate. Take a look.
Kilifi Deputy Governor Gideon Saburi breathed a sigh of relief after recovering from the novel coronavirus. But he is not out of the woods yet.
He has been declared fit after being subjected to 3 tests, all of which have turned negative. Naturally, the issue of the law, we will now follow up with him.
Saburi rubbed the law the wrong way when he failed to self-isolate. The deputy governor became the first leader to fall into the clutches of the deadly virus. The leader will now be charged for failing to heed to the government directive after the Cabinet Secretary for Health, Mutahi Kagwe, clearly stipulating that one's isolation aids in combating the spread of the deadly disease. Upon his arrival into Kilifi County, Saburi attended gatherings, and when he was confirmed positive, residents of the county panicked. The ministry's pronouncement led to Governor Amason Kingi to self-isolate. Those who break the quarantine rules after testing positive for coronavirus risk a 30,000 Kenya shilling fine or 3 years in jail or both. Abdez Ashim, Ebru TV.
The coronavirus pandemic has once again brought to the fore Kenya's not so healthy health sector, which is now reeling in consequences of sins committed over 56 years ago. Healthcare providers on the front line lament exposure to risk, lack of enough hospitals, and even a slim workforce. Take a look.
Na Mungu hatusamehi sisi wabunge kwa sababu tukiwa wagonjwa sisi tuna suluhu. Sisi tunaenda katika mahospitali ya kifahari, tunapanda ndege na kwenda Ulaya kutafuta matibabu, lakini Mungu anaturegesha katika majeneza na masanduku hadi nchini Kenya.
The chicken of poor planning and the ill health of Kenya's health system are coming home to roost in the wake of the global COVID-19 pandemic, which continues to give the government of Kenya sleepless nights.
We postulate that we'll have 5,000 cases by mid-April and potentially 10,000 cases by 30th of April.
The cold that Kenya caught from the Chinese sneeze once again opening the lid on the dire state of the already sick health system.
My name is Dr. Joshua Urua. I am a medical doctor and I work with Bliss Healthcare.
But where did it all start?
I think our priorities have been wrong all through. We have had a society that focuses more on, in fact our leadership focuses more on short-term gains. So I think our major problem is a focus on corruption and money, short-term gains.
The medical fraternity once again left on the underbelly of the pandemic, which they say had never been envisioned.
And it now brings the questions of ethics. Do I have the right to refuse to treat if I think I am not well protected? So we are at, those basics, we don't have them. I wouldn't say it has caught me off guard, but I never thought something of this magnitude will happen in my lifetime.
That made worse by a system which, since the existence of post-independent Kenya, hasn't gotten the seriousness it deserves.
Hii ugonjwa pia ni mzuri. Hivi, inatufunza adabu. Kwa sababu sasa, hawa wadosi wetu wakiwa wagonjwa wanaenda London, wanaenda sijui wapi, wanaenda India, mtaenda wapi sasa? Mnatibiwa hapa.
The shortcomings of our health system brought to the fore by the almost invisible virus, Dr. Orwa tells us, are deliberate.
Most of these people who go abroad are politicians, and they tell us we had this thing, or some of them come back dead abroad. They actually go to public hospitals abroad. Many of them do not go to private hospitals. So what is it that these people are doing for their public hospitals that we are not doing?
Then there is the idea of converting schools and airport hangars as possible COVID-19 hospitals.
What does that mean of the capacity or the level of infrastructure we have in our hospitals today?
Looking at Kenya as a country, we had time to correct our mess long before this hit us, and now this is exposing us at our worst.
And if you think the situation is bad enough right now, then medics say you should brace yourself for even a worse situation.
Especially if it hits us as hard as it has hit some other countries. If we get to a level where we are handling hundreds of deaths per day, Kenyans will be dying at home. That's just the truth. We don't have the capacity to do that.
And as a catch-up, the government says it plans to employ 1,000 medics to beef up those already on the front line. But from where?
Most of them are jobless. And the joblessness is not because there is no demand. In my opinion, it's because there is an artificial situation that has created the joblessness.
And in moving forward, the medics say there shouldn't be a next time.
So we've neglected what the public needs, and Corona is telling us there is no line. The air you breathe in China can reach Kenya and kill you in Kenya, whether you're the president or you're the mama mboga down there.
Now, the 63-year-old pilot with Kenya Airways who died of coronavirus will be buried at his Maliku home tomorrow in a ceremony to be attended by close family members and friends. Captain Daudi Kimuyu Kibati, who was taken ill on March 29th, died on April 1st, a week after performing his last international assignment. Kibati is among the 4 Kenyans who have succumbed to COVID-19 in the country.
The pilot tested positive after his doctor recommended COVID-19 tests. He was taken to the isolation ward within the hospital until his death on Thursday. 2 more pilots who tested positive are admitted at the same hospital. In a statement to newsrooms, the Kenya Airways company mourned the late pilot Daudi Kimuyu Kibati, who was the captain on the 787 fleet in operations department. The statement, however, steered clear of the cause of the captain's death, instead saying the funeral arrangements are underway. The second patient to die was a 68-year-old female Kenya Ports Authority employee who died on Wednesday night at the Mombasa Hospital isolation ward. He was buried in a low-key function at Mbaraki Cemetery hours later. Her daughter has been quarantined at the Coast General Hospital and will be tested. Mombasa Governor Hassan Joho confirmed receiving reports about the death.
We know of cases that you have dealt with. Unfortunately, we know of a case where someone has passed on last night. We are going to be ensuring that you have provided necessary support when a patient walks into your hospital.
He warned private hospitals against turning away COVID-19 patients or people presenting symptoms. Health Cabinet Secretary Mutahi Kagwe confirmed the 2 new deaths in his daily briefing on Thursday. This brings to the 3 the number of people killed by coronavirus since the disease was reported in Kenya on March 13th.
I'm also saddened to announce that we have lost an additional 2 patients who were tested positive to the disease. One in Nairobi and another in Mombasa.
The first COVID-19 death in Kenya was reported last week at the Aga Khan Hospital in Nairobi. Busara Naman for Ebru TV.
All right, on that note, we take a very short break, but we'll be right back with more news. Stay with us. All right, welcome back to Ebru Primetime News. Now, as a way of enhancing and enabling a safe environment to curb the coronavirus pandemic in prisons, Faraja Foundation, in partnership with Kenya Prisons Department, donated toiletries meant to benefit inmates. Led by the foundation CEO, Jen Kuria, the donation is aimed at assisting prisoners during these difficult moments occasioned by coronavirus, which led to the imposition of the dusk to dawn curfew by the government. Addressing the media after the distribution, Prisons Commissioner General Isaiah Osugo lauded the move, saying it will boost efficiency at all prisons across the country.
Today we are here to flag off a support with sanitary toiletries, because basically the lockdown has made it impossible for us to go to the prisons that we work with and to be able to support. And because of wanting to observe sanitation, we are providing soap today. Next week we shall provide toilet papers and other items that are required. This is because the Commissioner General requested us to be able to support in this, so that the inmates, even the officers that are in the stations, can be able to observe sanitation. We have done many other, in partnership with Prison Service, we have done very many other projects, but this is what is important.
What we would like to urge Kenyans is that we listen to what the government is telling us through the Ministry of Health, and let's listen so that we can minimize the adverse effects of COVID-19.
As I say that, I also want to acknowledge the very fact that we have walked the journey of partnership with Faraja from 1999. But this is a landmark because Faraja has teamed up with Kenya Prison Services to ensure that we enable our inmates to observe the basic hygiene during this trying moment of COVID-19. While saying that, I want it to be, I want it to come out clearly that the onslaught against COVID-19 cannot be singularly fought. It requires a multi-sectoral approach, both state and non-state, and that's why Faraja has responded to our request.
A section of Muslim leaders from Eldoret have called on the government to hasten importation of maize should there be signs of its shortage in order to cushion Kenyans against starvation, especially in the wake of the outbreak of the coronavirus. Speaking in Eldoret during the distribution of foodstuff to needy members of the Muslim community, the North Rift chairman of Council of Imams and Preachers of Kenya, Abubakar Bini Said, said the government should come up with clear mitigation measures to avert any situation of food shortage.
Ikiwa kutakuwa na upungufu Kenya ya mahindi ije wasagaji wapate kusaga, njaa isiingie katika nchi yetu wakati huu ambao ni mgumu wa corona. Kwa hivyo tunaomba wahisani wengine wawe kama hawa waliojitolea, hawa watu wetu wa dola waliojitolea kusaidia maskini, na watu wasaidiane. Na hata mimi kimwona jirani yangu ana njaa, basi nimsaidie, na wewe ni hivyo hivyo. Kila mtu amsaidie mwingine, tusingojee ufadhili kutoka kwa serikali. Mimi na wewe tukisaidiana, tunaweza kusaidiana na njaa tukaiangamiza.
10 people, among them former world marathon record holder Wilson Kipsang and Kapchemutuo MCA Ambrose Kiplagat, have been fined 5,000 shillings each for defying the dusk to dawn curfew. They will also be quarantined for 14 days at the state facility where they will be tested for COVID-19. Eton resident magistrate Charles Kuto ruled Kipsang and his co-accused were on April 2nd found drinking and gambling at Keelu Resort in Eton at 8:30 p.m. The curfew starts at 7 p.m. until 5 a.m. Kipsang told journalists that they had traveled from Eton and did not intend to disobey the government orders on the curfew. Omar said police would intensify patrols and enforce the curfew. Any restaurant, bar and other businesses found contravening the curfew would be shut.
Natoka Eldoret na huyu kuleta spare. Kufika Kielu jioni. Nataka kuchukua takeaway nyumbani. Time ikatupata huko. Unaona? So jamaa wakafika tukaona wenyewe wanafanya kazi mzuri. Tukaingia ndani. Ndio tuko hapa. Tukitaka kutoka curfew uweze toka, uweze tembea. Ikabidi tukae ndani. Unaona? Lakini sasa inatakana kila mtu wapi? Nyumbani. Sasa ni ile time saa 1 imepata hao huko. Ikabidi uweze fika nyumbani. Tukawahosti. Tukahostiwa sasa. Ujumbe kwa Kenya na kwamba watu wa keep distance. Hii corona haitaki michezo. People are dying. Sasa imefika 100. Unaona? So social distance, watu wakae curfew nyumbani.
Tafadhali tuchunge time ile yenye ilitangazwa saa 1 huko nyumbani, na hii ugonjwa si ya tajiri wala maskini, inashika kila mtu. Ndiposa mimi nasema niliheshimu nishikwe ili nikuwe example kwa wengine.
Central Region Commissioner Wilfred Nyagwanga has directed members of the Nyumba Kumi initiative in the county to work jointly with security agencies during this curfew period to handle emergencies that might arise. Meanwhile, Nakuru County Governor Lee Kinyanjui has urged President Uhuru Kenyatta to declare a total lockdown in the country to curb the spread of the novel coronavirus disease.
The calls to have President Uhuru Kenyatta up the partial lockdown to a full one continue to gather momentum. Nakuru Governor Lee Kinyanjui calling out those he terms as reckless as the country rushes to stop the spread of the coronavirus.
As a county, and also looking at what has happened in other countries where the authorities were reluctant to put a total lockdown from the start. Those countries that went half measure, those countries like China initially and also Italy, the results, also Spain, the results were disastrous. Unfortunately for us in Kenya, we have taken a similar path.
In Nakuru alone, the governor says the spread could get out of control with 2 cases confirmed. In East Africa, Rwanda and Mauritius are the only 2 nations that have implemented a total lockdown, while Kenya and South Sudan have a nighttime curfew.
We now have 2 cases in Nakuru, one for a 28-year-old lady and a 39-year-old gentleman who confirmed positive yesterday.
Transport. Ugandan President Yoweri Museveni has urged people to stay home but has stopped short of ordering a total lockdown. President Kenyatta on March 25th this year declared a national curfew within Kenyan territories from 7 p.m. to 5 a.m. to control the movement of people and subsequently the spread of the deadly virus. In Nyeri County, the issue of emergencies during curfew hours is one of the major concerns the county is facing, according to the Central Commissioner, Wilfred Nyagwanga. The administrator is now calling on those in charge of Nyumba Kumi clusters to work closely with security agencies to reach as many households as they can.
We want those Nyumba Kumi at the lowest level, the sub-locational levels, we establish community partnership with this security. Kama iko mtu iko na tatizo kama hiyo, anasaidiwa, anapelekwa hospitali ama kwenda kununua dawa. Isikuwe tatizo, kwa sababu hiyo wakikuwa na networks. Tumeongea na security up to the lowest level, the assistant chief, wanshiwe kama iko mtu mgonjwa, lazima gari itaitwa.
The regional boss says that they are working with assistant chiefs to ensure anyone who needs assistance is taken care of without any friction. He further says that the movement of vehicles ferrying foodstuff is not restricted, adding that tea farmers should continue picking tea and taking it to buying centers where lorries will pick the produce.
Taita Taveta County government has announced designated areas where all visitors into the county will be screened at the county's entry points before they proceed to attend to their daily activities. However, the county government has discouraged mass movement of people from other neighboring counties as part of the efforts to control the spread of the coronavirus. It is now mandatory for commuters traveling along Nairobi-Mombasa Highway to make stopovers due to screening at the designated points within the county. The county has set 2 entry points, that is Ndii and Maungu areas, as major entry points situated along the Mombasa-Nairobi Highway. Taita Taveta County Governor Granton Samboja says the measures will help in fighting the spread of coronavirus, which has spread across the world. Police have also been asked to assist in controlling the travelers at the screening points.
Lakini la muhimu zaidi ni ugonjwa huu ambao umekumba ulimwengu huu wetu wa corona. Ijapokuwa kufikia leo Taita Taveta hatujapata kisa hata kimoja cha mgonjwa wa corona, lakini majirani wetu wote wamepatikana. Kilifi imepatikana, Mombasa imepatikana, Kwale imepatikana, Kajiado imepatikana.
Governor Samboja says rapid response teams within the county are on high alert to ensure that they respond to any emergency that may occur within the county. He said necessary steps taken will help in preventing the spread of the deadly virus.
Muhimu kwa sisi kujitahadharisha, na njia pekee ukiangalia historia vile inaenda kitambo ugonjwa huu uanze kusambazwa na wenyewe kwa wenyewe, ni ugonjwa ambao unatoka sehemu nyingine kisha uingie kwa sehemu yenu. Ndio maana kuanzia leo na kuendelea tumeweka mikakati ya kutosha ya kuhakikisha wasafiri wote wenye wanapitia kwa kaunti yetu lazima washuke kwa magari na wapimwe.
Tuko na maofisa wa kutosha katika barabara hii. Hii ni barabara ambayo magari mengi yanapitia, na tuko na maofisa wengi ambao wanajaribu control watu wote, gari zote za passenger ziweze kupitia hapa, na tunaomba wananchi waweze kushirikiana nasi katika zoezi hili.
More screening stopovers will be at Rombo area of Taveta at the Kenya-Tanzania border, where travelers from Kajiado and migrants from Tanzania will be screened before they proceed to the county. Now back to Nairobi. Nairobi Water and Sewerage Company will repair existing public toilets to help with sanitation as they reorganize water equitability. The move will enable the government to curb the spread of coronavirus. In a statement to newsrooms, board chairperson Beryl Odinga said they shall ensure that hand-washing facilities are available in all the public toilets and police stations within the city. There will also be equitable water distribution in high-demand areas such as Mukuru, Mathare, and informal settlements. So far, Kenya has reported more than 100 confirmed cases with 4 deaths. Now, even before South Africa became hit hard by coronavirus, the country was struggling with a healthcare system battered by tuberculosis and HIV. Health experts say the vulnerable population in poor and overcrowded slums is now even more at risk. Take a look.
South Africa's overcrowded towns and slums suffer the most from the status of having the world's highest infection rate for tuberculosis and HIV. That means millions of poor South Africans have compromised immune systems. Health experts say the added threat from coronavirus could bring the already stretched healthcare system to its knees.
If it's a community outbreak with only a few people affected and we can contain the virus, it would be fine. We would be able to manage. If it is unfortunately an outbreak, let's say in one of the informal settlements, the risk of people there getting seriously ill would be worse. And those are the people also that we would be that we are afraid of will have to be hospitalized. And I don't think the system will be able to treat a huge influx of people seriously ill.
South Africa's pharmacists are on the front line dispensing medication and trying to educate on coronavirus prevention.
I think in the general communities where there's large populations, I don't know how they would be able to handle it, but I think they have made provision in the larger hospitals, in the main centres. I think they have made provision.
But South Africa's epidemiologists worry about the crowded slums where social distancing is almost impossible.
How can the sick person try as much as possible to keep themselves separate from other people? For example, by even if you're sharing a room, to stay 1 meter from people, because 1 meter is the critical distance over which the droplets of the virus can spread.
For this pandemic, South African authorities are hoping for the best case scenario, that the country's lockdown can bring it under control. Meanwhile, South Africa hospitals are preparing for the worst. Franco Puglisi for VOA News, Johannesburg.
Now, leaders and medical experts around the world have said that no matter who you are or where you live, if you want to stop help the spread of the novel coronavirus, wash your hands. Take a look.
Wash your hands. Wash your hands. Really, everybody, wash your hands.
Some people may think this disease is something that doesn't concern them and that it will never affect them. That it is something they only read about in newspapers or social media or see reports about on television. But it is very real, and it poses a great danger to every one of us and to our society as well.
Those are fine words, but one of the biggest challenges on the African continent is the simplest: universal access to clean water. Even in relatively well-developed South Africa, millions of residents lack clean, running water at home. It would take years to shore that up. So in the meantime, charitable organizations like Living Water International have gone into overdrive, setting up water points and hand-washing stations in countries including Ghana, Liberia, Sierra Leone, Zambia, Zimbabwe, Kenya, Uganda, Rwanda, and Burkina Faso. The organization's water and sanitation officer says people have enthusiastically embraced the program. This is especially important in high-density areas like camps for displaced people and refugees. In those places, groups like Catholic Relief Services are also upping their hygiene efforts.
And so we are able to reach well over 1 million Ugandans with new messages around hand washing and hygiene promotion in general. And so very specifically, that can mean, for example, that in the refugee settlements in the very northwest of the country, for example, like Bidi settlement, we have volunteers that are standing at the hand washing points where the refugees collect their drinking water. And we, while they're fetching their drinking water, we basically take the time with the refugees to talk to them about the coronavirus and how to better protect themselves and their families, to make sure that they keep their water clean and stored well, and that they wash their hands frequently.
Hand washing seems like a small, routine thing, but in the current crisis, maybe nothing else the average person does is more important. and maybe nothing else will save more lives. Anita Powell, VOA News, Johannesburg.
All right, this is where we wrap up Ebru Primetime News. Thank you so much for watching, and always remember to keep the safe hygiene measures. Wash your hands. Also, remember to practice social distancing. If you can, kindly just stay at home and stay safe. My name is Rachael. Mbugua, our sign language interpreter, has been Joyce Werimo. Do have yourselves a lovely night, and God bless you.